Dr. Michelle Pendrak. I am an optometrist at Siepser Laser Eye Care in Wayne, Pennsylvania. I have worked here for 6 years. I do full scope optometry here, but since we are a surgical center, we focus a lot on LASIK surgery, premium IOLs. I do a lot of the pre and post-operative care around Dr. Siepser surgeries. I also founded the Dry Eye Center of Excellence here. Dry eye management is a huge part of what we do here since we are doing so much premium surgery. Patients are not going to be happy with their surgical outcomes if they have something like dry eye getting in the way of that. Also, as so many people are aware, the ocular surface has to be pristine going into surgery to get accurate measurements. So we really do try and prep the ocular surface prior to surgery as well. About a year and a half. We utilize the HD Analyzer several ways. I became a large proponent of using the HD Analyzer actually in all of our cataract evaluations. We want to know if there is any dry eye in our cataract patients. Obviously, ideally, we treat that prior to their cataract surgery. Obviously, it's also important to know if a cataract patient has any dry eye before their surgery so that after their surgery, if they feel like the surgery caused their dry eye, we can look back and say, well, some of this was pre-existing, as you know. It's also been very beneficial for me. We use it on each and every one of our dry eye evaluations. It's really been a great educational tool because for so many dry eye patients, they may not necessarily feel their symptoms, but they will see it. 86% of dry eye is evaporative, and that's where the HD Analyzer really shines in capturing what is going on with the evaporative component of dry eye. And so it's helped with that disconnect between what patients are seeing and what we're seeing and helping them understand, okay, that fluctuating blurry vision, even though you don't feel it and may not necessarily believe me when I tell you that it's dry eye, look at this image. This is your tear film fluctuating, and this is why you're having that fluctuating blurry vision. It really just does a superior job of measuring that tear evaporation and really putting an image on it. You know, it's one thing for me to say to my patients, you know, your tear film is breaking up at 8 seconds. It's another thing for them to see it and also to see the extent of the evaporation. That's not something that I can necessarily measure or record otherwise. It's not something I can communicate to my patients. So it helps me see the extent to which their tear film is evaporating, and it also helps me show the patients the extent to which their tear film is evaporating and also how quickly it's evaporating. Absolutely. You know, a picture is worth 1,000 words. So I can say to a patient, you have evaporative dry eye, but for them to be able to see that image, to see their tear film evaporating, to see their tear film dip from the green to the yellow to the red, that's pretty powerful. It's a great education tool. It helps patients really understand the need to treat their dry eye. It helps them understand why their vision is fluctuating, because I'll say to them, look, this is measuring tear evaporation, but you can also really think of it as measuring visual fluctuations. Every time that tear film evaporates, your vision is dropping off right along with it. And it absolutely has helped us with patients as far as getting them to comply with the treatments that we recommend. If we say to them, we recommend this in-office thermal pulse heat treatment, they are much more likely to move forward with that recommendation having seen the printout from the HD Analyzer. Oh, absolutely. It's been invaluable. It's definitely, the ROI for sure is on our treatment conversion rates as far as our in-office dry eye therapies that we recommend. We don't have those statistics. We never measured them, but it has, in my mind, been invaluable for our conversion rates for our in-office dry eye therapies. You know, this is more, I don't want to say unique, but more specific to our office as far as the surgical aspect goes. But it's also just another layer of sort of covering all of our bases and really documenting pre-existing dry eye prior to surgery. Because if you get a surgery patient who isn't happy with their outcome and they will then blame anything on the surgery, it is so nice to be able to go back, look at all of the preoperative scans and say, no, really, you had this evaporative dry eye prior to your surgery. So when you say asymptomatic, what I find with a lot of specifically the evaporative dry eye patients is they don't feel it. Most of them, especially early on in the disease, their only symptom will be this fluctuating blurry vision that they don't even realize they're having until I sort of pull it out of them and say to them, do you have fluctuating blurry vision? So that may be the only symptom they have, and the HD Analyzer is great at capturing that. Also, if I have a patient who, I'm doing a dry eye evaluation, or maybe I have them in for a complete exam and they have sort of these vague complaints, but I'm not really impressed with what I'm seeing at the slit lamp, I will absolutely throw them on the HD Analyzer, get that vision breakup time, and that will help me really figure out what's going on with the evaporation in their tear film. Yes, the HD Analyzer has also been incredibly helpful for us there. We will do the HD Analyzer prior to in-office thermal pulse heat treatments. We will also do it after. So often patients, especially when you're doing these treatments that have a high out-of-pocket price tag, they are so quick to judge, and if they don't have what they deem to be a big wow factor, because as we know, a lot of these treatments have sort of a slow impact on their symptoms. It may not be an overnight change. They are very quick to judge it and go back and say, well, that expensive treatment didn't work. So we can go back and say, well, here was your tear film before, according to the HD Analyzer, here is it after. Look at this tremendous increase that you've had. And you can't argue with something that objective, obviously. This has been very easy for our technicians to be able to learn on. We have 3 technicians here. All 3 of them have picked it up very easily. I haven't heard any pushback or any complaints from anybody, so it's been incredibly easy to implement into our clinic.